If you want a flat, tight stomach but have failed despite dieting and exercising and see no results, chances are you might be struggling with insulin resistance without even knowing it. If that's you, this video is made for you. Your body is always working quietly in the background, carrying out all its functions with incredible precision. The coordination between your organs, cells, and tissues is more perfect than you can imagine, but without warning, things can start to go wrong. Subtle changes you don't pay attention to. You ignore the signals your body is trying to send you. There's energy that's supposed to reach you, but it doesn't. So you start feeling constantly tired, sluggish, drained. At that point, you might think it's just temporary fatigue, it'll pass. But what you may not realize is that your body is no longer functioning as well as you think. And behind the scenes, a serious problem could be developing, something called insulin resistance. So what exactly is insulin resistance? What are its symptoms? And how can we overcome it? Sometimes you might feel persistent fatigue, exhaustion, laziness, feelings that don't go away for weeks, maybe even months or years, and you convince yourself that it's normal, just a phase that will eventually pass. But what you don't realize is that you might already have insulin resistance. Now you might say, wait a second, insulin resistance? That doesn't make sense. I'm not even overweight. Sure, I have some symptoms, but insulin resistance? Isn't that only for people with obesity? Let me tell you this, never ignore any signal your body sends you. Before we go deeper, let's first understand what insulin actually is. Insulin is a hormone, and it's just as important as any other hormone in your body. If you're not familiar with what a hormone is, think of it as a chemical signal that travels through your bloodstream. Insulin is produced by an organ called the pancreas. Its role is simple but critical. It alerts your cells that sugar has entered the body through food or drink, specifically glucose. Think of insulin as a gatekeeper. It regulates how sugar enters your cells and ensures it's properly distributed throughout your body. After that, insulin acts on all the body's cells. It helps convert glucose into energy, which makes it essential for regulating blood sugar levels. Now, we know that the body's main source of energy is glucose, and we get it from the food we eat. Once glucose enters the bloodstream, insulin helps deliver it to all the body's cells. The cells then either use this glucose for immediate energy or store it for later when it's needed. So how does insulin resistance happen? Imagine this. The cells in your body suddenly go on strike. They basically say, that's it. We're not accepting any more sugar. We already have enough. Do whatever you want with the rest and store it somewhere else. At this point, insulin tries to signal the cells, urging them to take in the glucose. But the cells respond clearly. No, we're not letting anything in. As a result, the body's cells, especially fat cells, liver cells, and muscle cells, including skeletal muscles, which act as a major storage site for glucose and are responsible for nearly 70% of glucose uptake, stop responding to insulin. Over time, these cells become even more resistant. They grow more stubborn and increasingly reject insulin's signals. And this leads to a serious problem. The cells are no longer absorbing the glucose entering the body. The consequence? Blood sugar levels begin to rise significantly and gradually accumulate. Now the pancreas steps in, trying to fix the situation by any means necessary. To control the rising glucose levels in the blood, it starts producing larger and larger amounts of insulin. But this creates an even bigger problem. Over time, the pancreas becomes damaged because producing such high amounts of insulin puts it under extreme stress. Eventually, it can no longer keep up or produce insulin at the same levels as before. So now, instead of one problem, you have two: elevated blood sugar levels and a pancreas that's starting to fail. Sometimes, insulin resistance can be temporary if addressed early, but if left untreated, it becomes more severe, turning into a chronic condition. Blood sugar levels rise even further, leading to a much bigger disaster: type 2 diabetes. This brings up an important question that confuses many people. Is insulin resistance the same as diabetes? The answer is no, but they are closely connected. If you have insulin resistance, your blood sugar levels may still appear somewhat normal, but as we mentioned earlier, glucose can still be building up in the bloodstream, and typically, the symptoms associated with insulin resistance. If someone with insulin resistance eats sugar, their blood glucose levels will rise slightly, but they are not considered diabetic yet. This stage is known as pre-diabetes, where blood sugar levels are higher than normal, but not high enough to be classified as diabetes. However, severe insulin resistance, especially when ignored or left untreated, causes blood sugar levels to keep rising far beyond the normal range. Eventually, this can lead to the onset of type 2 diabetes. At that point, medical treatment becomes necessary. There are several symptoms that may appear in someone with insulin resistance, such as increased thirst, frequent urination, blurred vision, and excessive hunger. Even though these are classic symptoms of diabetes, they can also appear in insulin resistance due to consistently elevated blood sugar levels. But why does insulin resistance happen in the first place? The truth is, anyone can develop insulin resistance. No one is completely immune. However, certain factors increase the risk more than others. The most common cause is excess body weight, especially abdominal fat. Compared to the general population, individuals with central obesity have a much higher risk. Genetics also play a role. People with a family history of diabetes are more susceptible, which is why they need to be especially careful about their diet and lifestyle. Another factor is a diet high in carbohydrates or excessive sodium intake. In addition, people over the age of 45 are at greater risk. Women who previously had gestational diabetes are also more likely to develop insulin resistance. A sedentary lifestyle is another major contributor. People who spend most of their day sitting, whether at a desk or on the couch, with little to no physical activity. Smoking is also a significant risk factor, increasing the likelihood of both insulin resistance and diabetes. There are also certain sleep-related conditions, such as sleep apnea, a common disorder where breathing repeatedly stops and starts during sleep due to relaxation of the throat muscles. Interestingly, individuals of African, Latino, or Native American descent are statistically at higher risk of developing insulin resistance. There are also medical conditions associated with insulin resistance. For example, fatty liver disease is strongly linked to it. Another condition is lipodystrophy, where there is abnormal or excessive loss of body fat. Hormonal disorders can also contribute, such as Cushing's syndrome, which results from excessive levels of cortisol in the body. Hypothyroidism, an underactive thyroid gland, can also disrupt metabolism and increase risk. Certain medications may increase the likelihood of insulin resistance as well, including steroids, antipsychotic drugs, and medications used to treat HIV/AIDS. In these cases, the insulin resistance may be temporary. It can also occur in people with acromegaly, a condition caused by excessive growth hormone levels. Now, what about the symptoms? Many people with insulin resistance experience no noticeable symptoms at all. In most cases, it is discovered during routine checkups or when a doctor orders tests for another reason. However, a small number of people may show signs such as skin tags or darkened patches of skin, especially around the neck or under the arms. Other warning signs may include mild but persistent high blood pressure. For example, instead of a normal 120/80, it may be around 130/80. Blood tests may reveal fasting blood glucose levels above 100 milligrams per deciliter, triglyceride levels above 150 milligrams per deciliter, and low HDL cholesterol below 40 milligrams per deciliter in men and 50 milligrams per deciliter in women. If left unmanaged, these issues can progress to more serious complications, such as damage to the small blood vessels in the retina, leading to a condition known as diabetic retinopathy. So how is insulin resistance diagnosed? In the early stages, it can be difficult to detect as long as the pancreas is still functioning properly. But if symptoms are present, a doctor will typically request several tests, review the patient's family medical history, and perform a physical examination. Blood tests are essential, including fasting blood glucose and HbA1c, glycated hemoglobin, which reflects the average blood sugar levels over the past 3 months. A full lipid profile is also commonly requested. One widely used test is HOMA-IR, which is calculated using fasting glucose and fasting insulin levels. Although it is popular, it is not officially standardized by major medical organizations like the American Diabetes Association and is used more commonly in research and clinical estimation rather than formal diagnosis. Now we reach the most important question. How is insulin resistance treated? The primary treatment is lifestyle modification. This means improving your diet by reducing calorie intake, avoiding unhealthy fast foods, and limiting excessive carbohydrate consumption, since carbohydrates strongly stimulate insulin production. Weight loss is essential, but it should be done in a balanced and sustainable way, not through extreme or unrealistic methods, which can backfire. Working with a nutrition specialist can help you structure healthy meals alongside a proper exercise routine. Physical activity plays a critical role, not only in boosting energy levels, but also in improving the body's sensitivity to insulin. In more advanced cases, medication may be required. Drugs like metformin are commonly used to improve insulin sensitivity, especially in prediabetes or type 2 diabetes. Some medications may also be prescribed to lower harmful cholesterol levels. Can insulin resistance be completely cured? Not always. It's not as easy as it may seem. Many people struggle with consistency and fail to stick to the required lifestyle changes, which leads to complications. However, others who commit to proper nutrition, regular exercise, and medical guidance can achieve significant improvement, sometimes beyond what they expected. The most important takeaway is this: you must meet your body's nutritional needs, reduce stress, and maintain a healthy lifestyle. Some symptoms, especially those linked to genetic factors, may not be fully reversible, which is why long-term management is essential. What about complications? Like any untreated condition, insulin resistance resistance can lead to serious health problems. These include increased triglycerides, higher levels of harmful cholesterol, eye disorders, heart disease, and liver disease. In some cases, it may even contribute to Alzheimer's disease or certain types of cancer, as well as peripheral neuropathy affecting the nervous system. Elevated blood sugar also promotes weight gain and makes losing weight much harder because excess glucose gets stored in fat cells. It's important to note that not everyone with insulin resistance will develop these complications. Now, what foods can help? There is no single perfect diet, but some foods are generally beneficial. High-fiber foods help you feel full longer and regulate blood sugar levels. Fresh vegetables and fruits are essential. Legumes like beans and chickpeas are excellent choices. Low-fat dairy products can also be helpful, as well as brown rice. Some foods can be consumed in moderation, such as bananas, corn, oats, and cherries. On the other hand, certain foods should be avoided as much as possible, especially those high in refined carbohydrates, which significantly raise blood sugar and insulin levels. These include white bread, potatoes, pasta, baked goods, sugary drinks, and all types of fruit juices. If you want to protect yourself from insulin resistance, prevention is key. Don't wait for symptoms to appear before taking action. Regular checkups and routine blood tests can help you catch problems early. As long as you eat healthy, stay active, exercise regularly, and avoid smoking, you are significantly reducing your risk. In the end, the biggest threat to human health is often not external, it's our own habits. If you enjoyed this content and want us to keep going, don't forget to like the video and subscribe to the channel. Good luck with your training, and until next time, keep moving, my friend.